Well, to discuss this further, I'm now joined by a communicable disease control consultant, Dr. Bharat Pankhania. Bharat, good to see you this afternoon. Poverty seems to be key here, but which part? Is it about close living, jobs, or something else?
It is a perfect storm of all those ingredients, all of those items, and we have known about this for a very long time. So politicians ought not to say, hello, this is news to me. We have known for a very long time that austerity and poverty kills, and the coronavirus COVID-19 disease is exemplifying it very precisely. It is a mixture of all of those things. The overcrowded house, the poverty of living, the poverty of diet. And furthermore, these very people are also more likely, absolutely more likely, to be working in environments that bring them more closer to having that infection. So the bus driver, the taxi driver, the cleaner, the cook, all those occupations where they are more vulnerable, they can't just sit at home and do Zoom meetings, makes them more vulnerable to getting the infection and then bringing it in to a crowded home and, in fact, other people as well.
It's impossible to protect people under those circumstances, isn't it?
It is. And what we have to do is, we know that poverty kills, and what we have to say is these people need additional protection wherever it is possible. And I agree with you. Impossible in the middle of a pandemic to wave a magic wand and say, we're going to make it better for you. So what I say is, wherever you can, you should do your best. Therefore, for example, in healthcare settings, I have always advised you need to profile the more at-risk people and move them from patient-facing encounters if and when you can. And similarly, on buses and taxis, we give them additional protection, like wear a mask, give them advice on how to look after themselves, those sort of measures.
The social impact of this, the virus is widening the gap between the rich and the poor?
The virus is identifying very clearly that we've had a widening gap between the affluent and not so affluent. And the not so affluent people, their numbers have been increasing over the last 10 years. And we're seeing the results of what we would call self-imposed austerity measures in the UK.
As an expert in communicable disease, second wave, what are the prospects of that, and what could the impact be done on vulnerable people?
Yeah, we have to, I personally feel that the summer months will give us a little breather, and then the autumn months, I am very concerned that we will have a rise in number of cases because all the ingredients are there. So what we have to do is reinforce the infection control measures that we have started with, the hand washing, the wearing of the masks, the keeping of the social distance, and not going out in places where there are too many human beings. Those are the essential measures that we can take because we haven't got any vaccines and we haven't got any medication. So that's the only thing we can do.
Dr. Bharat Pankhania, thank you for joining us live here on RTUK.
Thank you.